Why'd you like Roosevelt? Well, no kin. Why'd you like Roosevelt? Well, no kin. Why'd you like Roosevelt? Well, no kin. Lord God Almighty was a poor man's friend.
In 1935, Congress passed the Social Security Act, a law to bring some security into the lives of America's most vulnerable citizens. The fifth article of that act, known as Title V, provided for health care programs for mothers and children, including services for children with disabilities. 4 years later, Title V expanded to include children with specific chronic illnesses. In these early years, children with special health needs often live their entire lives in institutions.
The doctors wrote the orders. The kid was institutionalized. Families came to visit on occasion. But really, the child was given up. Didn't belong to the family anymore. Their financial and physical responsibilities were done once they agreed to it. So there certainly wasn't collaboration with families. They weren't even part of the equation.
You know, I think back to the days of working in an institution, and that was a world unto itself. The institution was the school, it was the home. In many ways, too, the staff, we were the family. So very, very tough for parents back then, and very tough to have any kind of collaborative relationship the institution. I mean, not from lack of trying on their part or even necessarily lack of trying on the part of the people working there, but just the dynamics made it very, very tough.
And I really think we got the short end of the stick because we had no say-so, we had no transportation, nothing that we were included in. We were like, they threw us in a closet and said, forget about us. We went to I went to a handicapped school. I went to handicapped camp. And when I did go to public school, I basically more or less freaked out because I wasn't used to being around kids that lost. And it was like, I was scared. I didn't want to go.
In 1987, Surgeon General C. Everett Koop led the child health community's effort to develop a common vision of family-centered, community-based, comprehensive, coordinated, culturally competent systems of services. Over time, through family and professional partnerships, the vision of community-based care is becoming a reality.
Those of us involved with Title V programs for children with special health care needs have learned many lessons over the years. Right. We have learned over and over that a coordinated system of services, although difficult to accomplish, is absolutely essential for assisting children and families to achieve their full potential. These systems exist now because of partnerships between state and federal Title V programs, communities, and families. But these are delicate relationships that require careful attention and commitment. Meanwhile, things are changing in healthcare delivery. A trend towards decentralization and managed care arrangements raise great anxiety for the families of children with special healthcare needs who need that special care.
My major concerns with him are what health apparatuses he might need, like bilaterals for his tendons, to stretch his tendons. Just him receiving the services he should have, like diaper services, which has been cut under the new Medicaid formula. He needs things like rubber bed sheets, built-up spoons and things like that. Teach him how to eat, so he can get. No one's never told me that he's eligible for these things through Medicaid. And I find that real bad,
Most of the managed care organizations have not had the opportunity to gain Title V's experience with family-centered, coordinated systems of care. So, it's up to us, families and professionals like you and me, to make sure that what we have learned gets communicated and becomes part of any change in that system of care. The work that began with the Social Security Act's Title V more than 60 years ago continues today as part of the U.S. Department of Health and Human Services, HRSA, the Health Resources and Services Administration, through grants to the states, special projects, and partnerships with agencies and communities.
The professional family partnerships are growing. Families and professionals are working together as collaborative teams. And meanwhile, as both families and professionals move ahead on long-term goals, the day-to-day work goes on. The small triumphs, reaching for a toy, holding a toothbrush, learning a sign. All of the small things you do to make the lives of children with special needs as fulfilling as possible, creating better futures for each child and each family.
No, families are the reason that we feel so proud and strong. Oh, families are the reason that we've always carried on through the good times and the hard times, through the days we stood alone, through the sorrows and all the laughter. It's the love that keeps us strong. So when you ask me, it's so simple and so clear. Families are the reason we're here. See the pride in their face, it's what we're working for. Feel the pride in this place, it's the love we give that gives us more. Oh, families are the reason that we feel so proud and strong. Oh, families are the reason that we've always carried on through the good times and the hard times, through the days we stood alone, through the sorrows and all the laughter. It's the love that keeps us